Well, thank you, John Harper. It's always great to be here on the radio Wednesdays, 12 noon, right here on 90.3 FM, WEJF. And also, for those listening online, WEJF.net is a great way to hear the Helping Seniors radio program. And many of you also find this later as a podcast, every place good podcasts are found. Anything from Spotify to iHeartRadio to Apple iTunes to Hey Alexa, play me Helping Seniors. And the reason that we love having the opportunity to do that is because we find many people search by topic later on, and then they go, well, that's a good topic for me. And I think this is going to be one of those great mind expanding topics and almost maybe a little bit of a philosophical discussion. Our special guest today is none other than Dr. Lee Sheldon, long time friend of Helping Seniors, helped Joe get the whole organization rolling back when he was doing Brevard Alzheimer's, carried with him and helped Joe on the inaugural edition of the board of directors. And here we are today, helping us still in the work of helping seniors. How are you today, Dr. Sheldon?
I am great. It's great to see you again, Kerry. And yeah, Joe and I started this. He and I started our relationship somewhere in the mid 90s. I mean, we're going on 30 years. Now, Helping Seniors has been around for half of that, but, whether it was Alzheimer's or whether it was a TV show that I was doing, whatever it was, Joe was a great guest. Joe gave us the opportunity of expanding into areas that I wouldn't have expanded to otherwise.
Yeah.
And you never know how things are going to roll out. So now here it is 30 years later. And you and I are together on the radio.
It's great. It's great fun and it's great importance. And I was just going to pass this word along because I literally just got it from Steve Steckler, who is Joe and Terry's son. If you're not all that familiar, Joe was the real hero behind all of this. He got the Brevard Alzheimer's Association Foundation, rolling after his retirement from his last command in the Navy. In his early career, he drove submarines. He actually commanded submarines. Then he was in the Pentagon, and then his last command in the Navy was running the Navy's retirement community in Gulfport, Mississippi. And I presume that's what gave him a lifelong passion for looking after our seniors. And no senior had a better friend in our community than Joe Steckler, because Joe couldn't stay retired. He built up the Brevard Alzheimer's. He got the Joe's Clubs, they call them to this day, rolling adult daycare centers so caregivers can get some respite, and a lot of other great programs that organization does. And then on top of that, he also, 15 years ago when I met him, Dr. Sheldon, he was just launching Helping Seniors. And he said, I've learned a lot with the Brevard Alzheimer's. Many families do find themselves challenged with cognition issues, but he said all families at some time are tagged by things that are particular to seniors. And he said, we need an organization that is really going to help seniors and their families navigate these things. So there's some expert advice that's helpful to you. And so now for 15 years, we've been running the Helping Seniors, I call it education, outreach, and inreach, because we take 4,000 calls every year on our senior information helpline. I'm going to give you that number, give you a second to grab that pencil so you can jot it down. But it's your connection to good resources. And also, anecdotally, it's going to be your connection to car raffle tickets. But I'll talk about that later in the show, too. But the number that you want to get down on a piece of paper is 321 473 7770. I'm going to say it again, 321 473 7770. And we get calls about everything: housing, legal, medical, financial, transportation. You'll speak to Karen or one of the great volunteers. And by the way, if you want to volunteer and help us in the work of helping seniors, that same number, 321 473 7770, is a good way to get started. I was talking to Karen yesterday, and she's putting together a class. I think she's already got 7 or 8 folks who want to help us now, and we're going to have a training class coming up in August as well. So maybe you want to join that class and be doing some good work in our community. And Dr. Sheldon, I love it because you're the guy who got Joe started on the whole media thing, because when I met Joe, he was like, Kerry, I want to do the same thing I did with Brevard Alzheimer's. We've got to educate folks. And you got Joe started on TV, as I remember.
I did. I got Joe started. We had a TV program called Checkup. It ran for 8.5 years. It was primarily a health and medical program. We did it in conjunction with, at that time, Holmes Regional Medical Center, before it was even Health First, although it became Health First in the middle of the program. And we would have a 3-part program. It was almost like a Regis and Kathy Lee, if you remember in the day.
Yeah.
Now Regis and Kelly. And We had a plastic surgeon, Dr. Petra Schneider, and I would
Wow.
do our shtick. We'd do our 8 minute shtick at the beginning, and then we'd have two guests, and it was a lot of fun, a lot of fun. And Joe became a guest on the program, and I think I reached out to Joe. I think I heard about what he was doing with Brevard Alzheimer's, and we brought him on, and what a great guest! So we had a good time together, and here's how the relationship has developed and blossomed. I want to comment on if I could something you said, and that was
Mhm.
Karen. And
Yeah.
Karen works with volunteers.
Yes.
I, I go to meetings. I go there once a month
Hmm.
if I'm around. I try to get there once a month, and often I'm there, or not often, but sometimes I'm there at other times. The volunteers always have smiles on their faces. They have a
Yes.
good time doing this.
Yes. Yeah, and she's really done such a good job with pulling it together. So seriously, if you're looking to help us, we do events right there. We call it Joe's Senior Resource Center. We're conveniently located 1344 South Apollo Boulevard. We're there on the second floor. They've given us a wonderful space there. And what we try to do is maximize everything we can do on behalf of seniors. So that's the home for the helpline. It's where we try to do a lot of our media work. So we do our outreach there. We have classes there. In fact, we just finished up a class on Friday called Senior Tech Talks, and we're hoping that it's going to become a regular thing because, as you know, Dr. Sheldon, since I'm a patient at your office, when I have an appointment scheduled, they're going to send me a text message and ask me to, confirm if I'm going to be there for the appointment, things like that. And so often we go to doctors' offices, they want us to check in via our smartphone. So we are going to do the thing that everybody recommends. If you don't know how to do something technically, you ask your 9-year-old, and they'll
Hey, you're
they'll
right.
show you how to do it. Well, in this case, we have a millennial. Her name is Bree Prentice, and she's teaching these classes. And it looks like that's going to become a regular event for us. So you want to keep that same number, 321-473-7770, because you can always call up and say, I heard you guys talking about some kind of a senior tech class, or I need more information. Just call Karen or one of the great volunteers, and they will tell you how to do that. But I did go kind of down a little bit of a trail, because what I wanted to pass along, Dr. Sheldon, before we got into the meat of the show was, for those of you that don't know, we lost Joe early this year. And he and his wife Kerry, they had both relocated up to the Baltimore, Maryland area where their son is. And we had a beautiful, we lost Terry actually in March as well. So we lost both, two just wonderful people. We lost them both in the first quarter of this year. And then we had a beautiful memorial service at their home church, Holy Name of Jesus, here in in Indy Atlantic. But what I wanted to pass along was I just got news for the they're going to actually have services and interment at Arlington National Cemetery, because Joe really served his country in addition to serving all of us here. So that date is going to be August 26th, 9 a.m. And they're going to have a mass for him the day before. So if you want information about that, please give us a call, 321-473-7770. And I promise, Dr. Sheldon, we're going to get into our topic today, which is what happened to trust. This is going to be a great topic. I want to just add one more thing. To honor Joe, we created a thing that we call Friend of Joe program. And what we decided to do with that was, there's so many people who expressed how much Joe meant to them over the years. And literally, Dr. Sheldon, the last conversation, and you'll smile at this because you know how Joe was. Literally, the last conversation I had with him, which was like the day before he passed, and his son was sitting in the room with him, and we were laughing about it, kind of, good naturedly, when we were all together for the memorial service. I said, this is so typical Joe. He's laying there, and he says, Kerry, he said, you got to keep this thing going. It's tough to keep a nonprofit going. You got to keep it going. He says, you can use whatever you can out of my predicament to tug at heartstrings and get
That's
people
right.
to support the work of helping seniors. And that is important, that we keep this going. So we created a Friend of Joe program, and I'm just going to real quickly tell you how it works. If you'd like to be part of it, just call our office, 321-473-7770, or you can go online, because we set up a page on the Helping Seniors website, which is helpingseniors@brevard.org. And you can join. So far, it's about 2 dozen people that are already now on the Friends of Joe program. And what we decided to do, because we're always having to raise money for the charity. We said, if you'll make a $200 donation, you will officially become a friend of Joe. And what that does, to make it a little bit a kind gesture both directions, we always have had the deal with the car raffle that if you buy one ticket, it's $25 donation, or if you go ahead and get five, you get five for 100. So since you're making a $200 donation to the Helping Seniors, we'll go ahead and send you 10 tickets in the raffle, so you have that. But in addition, we will put you on what we call the Friend of Joe honor roll, and that does a couple of things. We first of all, we have it online at our Helping Seniors of Brevard.org website, and we're hoping by the time we get to December of this year, we're going to have a full page that we publish center section of Senior Scene magazine, and we're going to list everybody who wants to be listed as a Friend of Joe on the honor roll. And it's really heartwarming to see the nice comments and the nice things that are coming back. So if you're interested, it's called Friend of Joe. And if you call us or go on to the website, you can find out more about that. And so,
let's do this right now.
Okay.
Let's make Eleanor and Lee Sheldon a Friend of Joe.
I love it. I love it. Oh, and I forgot the best part. This isn't going to mean much to you if you're on the radio, but I'll try to hold this up so Dr. Sheldon can see it. You actually get a special Friend of Joe pin. You get a commemorative pin. And the only way that you can get one is by being a Friend of Joe. And thank you, Dr. Sheldon. You and Eleanor certainly have been friends of Joe for all these years. And you too have made such a difference for seniors. And that's a perfect segue into the conversation for today, which is all about trust. And yeah, I was starting to say, I said, no, let's save this for the radio. We were talking before the show. We just finished up a very, very successful workshop yesterday with our friends at Zon Beachside. It's called "Is This AI?" And it was a co-venture or co presentation with our friends from ARP, and they literally had brought some folks in from San Antonio, Texas, to lead the talk from a group called Senior Planet, which is aligned with ARP. And their whole goal, as you know, they're very big on trying to help keep us safe from scams and things like that. And they wanted to really teach us about these things called deep fakes and different things, and help us understand when we see something online, is it real, or was it possibly AI? It was a terrific session. They had room for, I think they had room for 90 people, and it was standing room only, how it turned out. So we're grateful to our friends at Zon Beachside for making that possible, and our friends from ARP to bring in kind of nationally known talent to be able to teach it. It was a great event. But what I wanted to say, though, Dr. Sheldon, is when you titled the show topic for us, "What Happened to Trust?" I was really thinking, like, maybe that's part of how our trust is eroded. We don't know what to believe anymore.
Yeah, you're absolutely right. This essay seemed to resonate. Of course, that was my intention. I always want my essays to resonate, but this one actually did. So we're talking about trust, and in this case, we're talking about trust in dentistry. We'll get into that in a little bit more detail. But as you said, we're always looking around us to make sure that we can trust the information that we're hearing. And so whether it's in dentistry, or whether it's in medicine, or whether it's a store you go to, or the claims you're seeing on TV, or getting an email, you're not sure whether it's a scam or not, you're right. Trust is number one. And so we decided, at least I decided, because I'm the essay writer in the office, I like to do this. Although, it's interesting, Kerry. It used to be when I would write the 300-word essay for Helping Seniors, and I do that once a month. Mm-hmm. And that is the topic of the radio program. So anything we're talking about today will be in the Helping Seniors magazine in September, right?
Right.
Yeah, because I write the essay, we talk about it on the radio, and then we publish it the following month.
Right.
And I would do the essay, and then I'd sit on it for a day or two, and I'd rewrite the essay. And of course, I have to get it to 300 words or less. And so I keep on playing with it, massaging it, and I finally get there. And then once I get there, Kerry, then I've got to come up with about 8 questions for you, for our listening audience, so that we have something to discuss. And you go right through the questions, and you're very, very good. And what's nice about Kerry is that Kerry will take those questions and then he'll expand upon those questions. Kerry's a radio guy. That's what he did. And so we keep on going and going with that. Well, now I dictate it into Chat GPT, and I can dictate for as long as I want. I might get into a conversation. I might go with 800 words. It doesn't make any difference. And then at the end, I tell ChatGPT, make this into a 300-word essay and give me 8 questions for radio. Sure enough, it does that. Now, that doesn't mean I don't massage it, but the massaging time is far less than it ever was before. And so, does AI, am I using AI right now? No, you're hearing my voice. You really are. But do I use AI to prep? Yeah, I do. And it has great advantages. But then again, the other side of it is that AI can figure out a lot of stuff, but it also is not always 100% accurate. Even ChatGPT will tell you they're not 100% accurate, and so you keep on asking questions. So there is the upside and the downside to everything we do, but we're taking advantage of the technology, which has reduced the amount of time that I spend in prepping that essay tremendously.
Yeah, well, but it's still the topic because that was one of the takeaways actually from yesterday with the is this AI workshop. They literally were showing two photos and they were asking the audience, can you tell me if which one of these two, one of them is AI, one of them was a real photo. Can you tell the difference? And so it was very interesting because I mean, without giving the whole thing away, part of it was like as you zoom in on the photos, if the teeth are 100% perfect, there's no skin blemishes, there's some weird they call it hallucinations is the term that they use because the way they explain it is that in AI it's just grabbing everything that's out there on the internet and trying to give you something that represents what you just told it to give you. And so a lot of times it gets it right, but occasionally there's something you have to scratch your head. So apparently we still have to be involved in the process if it's going to work. But I do think when we talk about this whole trust issue overall, that's one of the reasons why I think we see so many ads. You and I have we've done radio shows, we've done TV shows that you actually title are too many people having teeth extracted. And I guess that was a reaction to all these commercials that say, oh, we can just yank everything out and set you up in a day. And you guys have been pioneers in dental implants. And in fact, just the other day, went to the mailbox and there was a great magazine that you guys send out that has all the high tech things that you guys are able to do. And so you've kind of been at the forefront of all this, but then you see all this stuff on TV and you're not sure what to believe.
It's true. And so the reason we have the magazine is we want to compete with everybody else, and we offer everything that is advertised on TV, and we think we do it pretty well. And so yeah, within the marketing realm, we've got to be there, and we always have been. I mean, early on it was radio and TV ads, and now it's the magazine and website and and all the other things to do with social media and everything else. I mean, so you've got to in order to be able to compete, you've got to be able to have a public perception that you're there. And I always liked marketing, so I was able to do that. And I always was on radio and TV, so I didn't mind being in front of the camera. But now it has to be a lot more sophisticated. I've got another visit, even though I'm retired or semi-retired. I'm visiting with a social media marketer today at 4 p.m. So it keeps on going and going and going. But that's the stuff that you do. That's what we do. Okay, so 16 pages talks about how great we are and all the services that we provide. And you look at the magazine, and it's impressive. It's done by somebody in California that we've been using for 15 years, and we keep on refining it. But if you take a look at what's going on right now, everybody claims they do this, this, and this. And you don't know whether we're better or worse or whatever it is. You don't. I mean, the advertising is going to say, hey, we've only trained for 2 weeks in this, and we've trained for 3 years in that. It talks about the services that you represent. But you know what? What about the services that we decide not to do because we don't think you need it? We don't have anything reserved for that at all. And my campaign right now is, and it looks like it's coming to fruition because it was the star of our monthly newsletter that we send out to all of our patients, anybody who's expressed some interest in us, is restoring trust in dentistry.
Wow.
How do we decide not to do something? When is it better to look and to observe and to wait, take advantage of some preventive measures that might be out there? Maybe extract from the tooth and putting in the implant in is not the thing that we should do, even though we could do it. Maybe it's better not to do it. Maybe it's better just to look and observe and see what's happening with this. Maybe it's better to treat disease. Now, you know, I'm a periodontist, and periodontists are dedicated to saving teeth. There are so many times when there was a yes, you've got to extract the tooth, you've got to extract these teeth, you got to preserve the bone for dental implants, all that type of thing. And I said, wait a minute. I don't know that we can preserve bone for dental implants. After all, when we extract teeth, we lose bone just by virtue of the fact that the bone doesn't have anything to do. It's not supporting the tooth, so the bone will go away all by itself. And there were a lot of with the patient was, how about if we do this? How about if we control the infection? How about if we just see how we do over the next few months and see whether we can get this to reverse itself or at least to stabilize? And that's where I began in my 30s, and I'm a lot more than in my 30s right now. And these patients had their teeth 30 years later when they were told, you got to extract the teeth. There's nothing can be done, blah, 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 blah. That's a lot of what restoring trust is all about. There are a number of different procedures, and we can go over them one by one if you want, that are available to us that we can do. And the question is, do we have to do them? What's elective and what's required? And I think where we've gotten into trouble is that we've confused elective with required. That what is being told to us needs to be done is something that could be done if you want it to be done, but it's not necessarily going to affect the longevity of the tooth if you do it. So we've got to get better at this line being blurred between what we call the have tos, in other words, you got infections and you have to do it, and the want tos means we need to decorate or we're going to give you more teeth to chew on or whatever it is. So and that's where we concentrate our efforts. And if you take a look, I know I'm being awfully long-winded. My God, this is not radio right now. This is a monologue. Go ahead.
No, I was just going to say it's important because, I was thinking about one of the challenges that we have. I think about it from the patient's perspective. Like when I walk in a dentist's office, it's like the same as walking into, I don't know, your car mechanic or your doctor, or maybe you have to talk to a roofer and they're telling you all these things that need to happen. And you don't really have enough personal skill set or knowledge to know if it's correct or not, or it's accurate. So at some point as a consumer, I have to try to make a decision like, are they telling me straight, or is this like a bill of goods? And I think all of us have hopefully a natural level of skepticism. We're getting close to our mid-show break, but I did want to ask one more question about, like, I notice when you come into the office, it's a very kind of a low, I would call it feels very low pressure. It's like, we're always afraid, by the way, people love to buy, but they hate to be sold. And so, I always tell people, like, you go into a store and somebody approaches you, say, can I help you? You said, what's the first words out of your mouth is, I'm just looking, which basically is a euphemism for let me just kind of get settled in and see what I need here. And the last thing you want something, oh, this would look great on you, And so how does your office work with people to help them get into a comfort zone? Because maybe they're new to the area. Maybe they don't know that you've been here since 1980. They just moved from some other state and they're just getting established. Some say, oh, go see Dr. Sheldon. And you've got to now build that whole trust level with that person who really doesn't have that history of what you do.
Well, you're right. On the one hand, we've got the marketing, which is there to get people in the door. But what happens once they get in the door? And that has very much to do with eye-to-eye contact with our secretaries standing up and greeting you, to bring a patient in, understanding that our staff has quite a bit of knowledge. And then they start to interview you and find out what you want, so that we can tailor if you have disease, I'm going to tell you, obviously, but we want to tailor it to what you want and kind of break down that we call it an overcoat, that overcoat of, I wonder if I'm going to be sold, I better be careful, and all the kind of stuff, and just get into a conversation with the patient. The last thing you can do in 2025 is say, well, I'm the doctor and I know
That's not
best.
gonna work.
I'm not sure that ever worked, but it doesn't work now anymore. We've got Google, we've got AI, so we can find out what's really true and what isn't. So we have to get into that conversation as to not only what needs to be done, but why it needs to be done and why maybe it's not a good idea. And we can talk about more of that after the break if you'd like.
No, that sounds good. We are having a conversation with Dr. Lee Sheldon with Solid Bite. It's that great 30, well, no, wait, 19, I can't even do the math anymore. So
45
45
years.
years. Oh my goodness, of serving our community. And then people call on you from all over the globe for advice on how to run their practices. And you're always on the cutting edge of technology. We're going to continue this conversation about trust, what happened to trust, and maybe you can still find it. So there's good news in this, and we're going to be back with the second half of Helping Seniors Radio in just a moment. Make sure you stay with us. Well, thank you, John Harper. Welcome back to the second half of the Helping Seniors Radio Show. We gather lunchtime around the radio every Wednesday right here on 90.3 FM WEJF, 30,000 watts, as they used to say, blasting up and down the coastline of Florida here on the East Coast. You know, Dr. Sheldon, I was smiling. Dr. Lee Sheldon is a noted area periodontist, Solid Bite Dental right there on Sarno Road, at least for the moment. We're going to talk about that as we go along too. But he's our guest today. We've been having a conversation about what happened to trust. And I was just going to say, I heard a real estate agent, you know, I've always talked about our county being a little bit unusual. Brevard County, you know, we sit on the Atlantic coastline, and I always tell people when I meet people who are not from around here, I say, oh, it's where we launch the rockets. We can run out in our backyard and see them send rockets to space, which is not something you can say in most places around the USA. But it is an unusually shaped county because it's 72 miles north to south and fairly narrow in most places. And so we also talk about logistically, you know, you have people who live, we often say in Helping Seniors, we're trying to serve people from Micco to Mims, which is two small communities, one at the extreme, Micco is in the extreme south and Mims is in the extreme north. And then I heard a real estate agent say, no, we have 72 miles of golden sun-kissed ocean. So I thought that sounds better. So I like it. But we're talking about what happened to trust. And during the first half of the show, which is why I love the fact that these are podcasts, because if you missed it, you can always go back and pick it up. You can find it on helpingseniors@brevard.org. You can find it on our YouTube channel or our Facebook page. And we've been talking a lot about why patients may be hesitant when they show up at the dentist office. We talked about the role of how the medical office team can really help build some trust. But I want to ask you when this was a question that we were talking about. Can you elaborate on a time when no treatment is the best course of action? Because I guess you walk into most of us would probably walk in the first time and say, well, we think we're having this problem. And then we get a diagnosis of no treatment. That's interesting.
Yeah, let's give a couple examples. There's one that came in yesterday, although she wasn't told this, but I've seen this an awful lot. You know, you have gum recession and you're told that you need a soft tissue graft. Okay. So is that a want to or a have to? And it is presented sometimes as I have to. If you don't get this gum tissue graft, you're going to lose your tooth. And the answer is that's almost never the case. A gum tissue graft is done in order to be able to cover a root surface. So the root surface, which is relatively soft by comparison with the enamel, doesn't erode or helps to reduce sensitivity. That's the reason we cover it over, or we do it cosmetically, so the gum tissue looks good and you don't have this long in the tooth look. That is a want to, not a have to. But it was presented as a have to. So then I see the patient and say, no, you're not going to, let me reassure you right at the beginning, you're not going to lose this tooth. You can keep this tooth with recession. It may be a little bit more difficult to brush it because the gum is a little bit lower on that tooth, or the tooth may erode. And I can say, but there's no evidence of erosion now. Or I'll say, there is some erosion that's going on. So it's a cupped out appearance. Maybe it's a good idea. And the patient says to me, well, I'm 85 years old. Is it going to get any deeper? I said, it's not going to get deep enough that you need to worry about that. And we can look at the nuances as to whether, in fact, it is a have to or a want to. And I want to be able to differentiate right at the beginning those two things. I have to do it, and that's primarily infection. And infection includes tooth decay and periodontal disease and all those types of things. Or want to means it's there to decorate or to allow you to have more teeth to chew on. And sometimes, by the way, if you don't have enough teeth to chew on, it puts too much stress on all the other teeth. And so, sometimes the have to and want to's become blurred. But that also has to do with what it is that you want, how much money you are willing to spend to do that, and whether it's a good idea to wait or not to wait. If a patient says, I need to have my teeth out so that I can have a denture, the answer is, well, why do you want a denture? If the person then says, well, I don't care about how I look, I said, well, you've got teeth and bone right now. You're always going to be better off chewing on the teeth that are in the bone than taking out the teeth and give you something that looks good, but is literally a wig that's floating on what is your ridge. And so we've got to look at that and make sure that we're making the right decisions. Michelle and Matthew, Dr. Furtado, and my son, Dr. Matt Sheldon, do a beautiful job in doing treatment. And, we are one of the top, if you will, producing dental offices around. I mean, it isn't that we don't do dentistry. We do a lot of fine dentistry. But the question then becomes, do you need to do it or do you not need to do it? And that's one example of gum recession and whether you need it. There have been other patients who have come into me and said, well, I have severe periodontal disease, and I was told I need to extract the teeth in order to be able to retain enough bone for dental implants. And Kerry, unless the teeth are really loose, unless when you bite down, you feel pain because the tooth is moving back and forth, like when you were 10 years old and a tooth got loose and in preparation for the tooth fairy. Unless it's that way, we can get that periodontal disease controlled and reversed. And instead of spending the multiple fortunes of dollars in order to be able to put dental implants in, we can save those teeth. I pride myself, during my career, in the number of patients who were told, I need my teeth extracted for dental implants. I need my teeth extracted so I have enough bone remaining for a denture. And that statement is pretty much untrue. That if you
Wow.
know what you're doing to get periodontal disease under control, and it takes talent, and it takes diagnostic skill, it does. And that's why we talk about, if you have periodontal disease, go see a periodontist and go see a periodontist who's dedicated to saving teeth. Then there are opportunities which will restore function, which will allow you to chew, or keep you chewing at a cost that could be 1/10 of what it would cost if you extracted the teeth for dental implants. And not only that, and we've talked about this on the air, it's easier to control periodontal disease on natural teeth than it is to control periodontal disease on dental implants. And those people who lose their teeth due to periodontal disease are more prone to getting periodontal disease on dental implants. So from every respect, we're better off trying to save teeth. And, the track record is well over 90%, probably well over 95% on saving teeth with periodontal disease and be able to retain those teeth in function and in health.
Yeah, no, it makes perfect sense. I was thinking, even as you said that one of the challenges is that I think we've talked about this on the radio before. As kids, we were raised on, brush your teeth so you don't get cavities, and nobody really ever talked to us about the importance of gum disease. And then when we get older, then we realize, wow, we're having trouble, and the cavities aren't really the problem. It's back to the gum disease, and that's such an important part, I think, of this message. But coming back to that, I was thinking also, as you talk about it now, you have such great technology tools that are available to you. I know you do a program that helps us a lot as a charity. It's called the Solid Bite Gives Back program, where people can do like an introductory visit to your office, and you take like a couple of hours with them, and you do the whole everything, like CT scans and all this. And we've done radio shows where we talked about that's important, so that the client the patient is getting the best information possible, but it's also seems like it's important for you and the medical team, because then you have the right information to give the right uh, advice about what should be done next.
Yeah, I went into practice before all of this technology was available. And then you do the examination, say, well, you need these x-rays. It's going to cost X amount of dollars. Well, you need a CT scan. It's going to cost X amount of dollars. And, people would come in for the examination fee, and then it would end up being 3 or 4 times. I didn't like that. I couldn't
Yeah.
stand that. And finally I said, for Pete's sake, I need all of this diagnostic information to know whether you need it or not. If a root canal is failing, I can see that a heck of a lot better on a CT scan than I can on regular x-rays. Why am I charging this for this and this for this and this for this? And some people will say yes or no, and I'm limited as far as what I can advise you. And frankly, there are a lot of times when I'm doing CT scans where I can save you money rather than it costing you money. So finally I said, no, we're not going to do it that way. We're going to charge a single fee. It's $99, and we get everything I want. That way, every patient gets the same exact diagnostic information, or more importantly, I get all the diagnostic information, and it's there right there at my fingertips. It's there for my assistants to look at, because my assistants are told you better be able to diagnose just as well as I do. And so everybody is in some level of training, and you'll find our assistants are really, really knowledgeable because I'm requiring it. I want them to be able to converse with the patient and know what's going on. And, when assistants graduate from school, you're saying, you're not allowed to diagnose. You're not allowed to diagnose. You can do the things you're not allowed to diagnose. And they come into my office, and I'm saying, you better learn how to diagnose. You better learn how to diagnose. And so we said, all right, patient comes in, $99. I get everything I want, and then I can talk with you rationally about what's going on and what you need to do and what you don't need to do and what's elective and what's not. What's interesting is that we then developed a relationship with Helping Seniors and other charities in the county. And I said, write a check, or these days, online, whatever you need to do with your card, $50 or more. If people off the street is paying $99, $50 or more to Helping Seniors of Brevard, and all the money goes to Helping Seniors of Brevard, and we do the same thing: the CT scan, the full mouth X-rays, the 2-hour examination and evaluation, that type of thing. And it's worked out very, very well for the charities. I think we're close to $300,000. We haven't gone over $300,000 by now to the charities, and it's good for you, and it's good for me too, because I'm not guessing anymore. I've got the information that I need, and I can share the information with you. And that's why it becomes a very no pressure situation, because it's a discussion, and it's not me walking in and I see you for 7 minutes. I'm with you for a half hour, 45 minutes, and my assistants are with you longer than that, so you can have the discussion about the what ifs. What if I do this? What if I don't do that? That type of thing. So that's the program we have with Helping Seniors. So it's $50, and you get all the diagnostic information. And forget me, you get to experience my assistants, and they're top notch.
And if somebody wanted to take advantage of that program, how do they reach you, or what's the next step on that? Because it is a great tool, I think.
Yeah, if you're online right now, just go to solidbite.com. You can make an appointment online. Or if you're listening to us during daylight hours during the week, Monday through Friday, call the office, 321-259-8000.
I think partially what you were just talking about maybe even partially answers our next question that I wanted us to discuss, because this goes back to kind of the heart of this trust thing. And we kind of opened the show talking about this. How do I know when I show up at an office and I don't know you, and I'm maybe new to the area, or I don't really have a background, and I show up at the office, and how do I know if I'm being sold something or if I'm being cared for? Because we don't really have the skill set to determine a whole lot about that from the patient side.
I think, from a patient perspective, there's an awful lot of why that occurs. I had a patient yesterday This patient is an engineer, and engineers always challenge me. Engineers are into detailed work. He even corrected me and told me there was a difference between tensile strength and shear strength when I said the
Wow.
wrong thing.
Wow.
So he had a broken tooth, and the tooth was broken below the gum line, and he wanted to go into it with me about saving it versus extracting it.
Hmm.
And I went into precise detail as to what would happen if we did not extract the tooth and if we just took away the broken piece. And then once I got into detail and I was able to go over it on the x-ray and the CT scan showing him where the fracture was, and I even took the time to draw a picture of what would occur and what we would need to do. And by the way, I did open up the possibility, we could try this. Here's what I think is going to happen as a
Hmm.
result. As long as we go into the detail of what's occurring there, then he was perfectly comfortable to say, all right, now I've got the information. Now I should extract the tooth. And then he dismissed me. He said, thank you very much, Dr. Sheldon. And that was it. I think the whys and the discussion are really, really important, because what I don't care whether we're talking about a new roof or whether they're talking about getting new teeth. There are nuances to every discussion. What happens if I do? What happens if I don't? And the dentist should be able to be prepared to talk about that rationally, in order to be able to help you make a decision. I think that's as opposed to the dentist who walks in and says, "Well, you need all this," and then walks out. I think there is a difference there. From a business perspective, we're in business to make money. I mean, I've got to pay my staff.
Yeah.
We all deserve to make the income that we think we should be making, but that should be secondary to. I don't want to just chalk up a procedure. We have to do this. We have to do this. We have
Mhm.
to do this. I think the discussion and the whys and the understanding as to the differences are, and what actually has to be done and what you might want to do. Just by having that discussion, a lot of patients say, good, now I understand. Now I do want to do this. And the others say, listen, I want to establish a relationship with the patient, and the patient wants to establish a relationship with our office. Let's take care of the have-tos right now, and let's see how it goes. And it may be 6 months or a year from now, I'll be ready to go to the next step. I want to be able to establish a relationship first. That when you start to see that and you start to develop okay, I'll do step one, but I'm not ready to do step four
Mhm.
right now. What happens if I just do step one? Will that be enough to stabilize me? And the answer will be yes or no. Then you start to develop the relationship, and then you have the trust to go to step two, step three, step four.
Well, I think the key denominator in all of this is what we're talking about is there's a communication uh, channel that's so important for the person who's maybe the buyer or the purchaser of the services. In this case, it would be the patient, and the person who's going to provide the services. In this case, the dental office. Because I was thinking like one of the worst things. This because I've seen this happen, particularly in the medical side of things, is that there becomes this conversation that okay, you need surgery, and basically the decision is presented by the surgeon, like, okay, I can schedule you Friday at 2. It's not even like there's a discussion about this should happen. That's a terrible place for the patient to be in, because you never get to really and then then that's as he's closing the door on his way out to see the next patient, so you never really get a chance to even ask the questions. But it seems like asking these questions is really that communication part is really important. And I always go, well, you are the patient, you have the right to ask these questions. I mean, am I saying that right?
I think you are stating it right. And unfortunately, sometimes when you get into the position where the dentist is rushed and can't answer the questions, and then you're talking with the assistant may be just trained on finances and saying, well, it costs this amount of money and we can divide it out this way, or we can go to this finance agency and that type of thing. And that's why in our office we didn't have that. I didn't want that. Whether we're talking Courtney was the lead dental assistant in our office, and she's been there for 16 years. Or we're talking about Ashley, who is the lead surgical assistant. Or we're talking talking about Joy, and Joy was a dental assistant in general dentistry as well as in specialty work. I want the knowledgeable people there, and the knowledgeable people can answer a lot of questions, but the best thing about knowledgeable people is they know when they don't have enough knowledge to answer the question, and then they can go back to me and they can ask me the question. Or the patient has the option of making a second appointment with me to talk with me to answer the question. And there's no charge for that. We're trying to get information at that point. It's when you see that, at least in my way of thinking, because obviously I developed those principles of this practice, and Michelle and Matthew would carry on those principles to the letter on discussion and knowledge, and we don't have to do those type of things right now. If you feel that and you have the full ability to communicate with those people who you're dealing with, you're going to be in a much better position to make the best decision for yourself. And whether we're the right office for you or not, that's a decision you can make, but it certainly is made based on a position of knowledge and trust and discussion. Well, not knowledge and discussion, which develops into trust. Then you have found perhaps the right person for you. And by the way, maybe you found the wrong person for you. Maybe we are the wrong people, but it's certainly not based on lack of discussion. It's based on discussion.
Well, it's based on a free flow of information so you can get the information you need to make the best decision. Because again, like I said, particularly in a medical practice or some case where you don't really have the skill set to know everything that needs to be done, you best get the idea. I was thinking about it even when it comes down to, because we work with a lot of elder law attorneys, it's the same thing. When you walk in and you say, well, here's what I want to try to accomplish for my family, and I want to do this way, there's a place where you have to put some trust into the person that you're dealing with to be sure that you're going to get the outcome you want. Because what is it they say in the attorney's world? The person who represents themselves has a fool for a client. So it's all about learning how to get the help you need, and then to kind of sift through it to make sure it's the right direction. Now, one of the things that we talked about a little bit earlier in the show was you were mentioning about that it's kind of important to talk about sometimes what you wouldn't necessarily need to do in a case. Because I guess people, walk into the office, they pull out all my teeth, they're bothering me. And you might, after examining, say, well, we don't have to go to that extreme here. We could do this instead.
Yeah, there are times when a patient will come in and say, well, I was told I need an implant here. And
Mm-hmm.
the question was, well, do you need an implant here? And so let's assume that I see a patient who has a tooth
Mm-hmm.
where the root canal was done, but the root canal, there was more to the root canal that could have been done had the patient seen a good endodontist, which is the root
Mm-hmm.
canal specialist, to get that done. Well, on the one sense, I could say, well, you've already had a root canal and it's failed, so good, I'll take out the tooth and we'll put an implant in. On the other sense, I could say, let me send you to this endodontist who I know has this particular capability, and let's see if the endodontist feels that uh, he or she can control this, can get this infection under control. That would be an example of, I would like the second opinion from the specialist who I know can do the work and can get this infection under control without extracting the tooth. We do a lot. We do a lot of referrals to endodontists. We're known as a dental implant practice. That means we take out a lot of teeth, we put dental implants in. But if you take a look at the endodontist group that we refer to, Brevard endodontists, we refer to them a lot. There's other endodontists that we do. We're probably the best referral source for that group as well, because we'd like to be able to save teeth if we possibly can. An example also is you've got periodontal pockets, your teeth are loose. Um, we think we're better off at extracting the teeth. And you go, you measure 7s and 8s and 9s and things like that. And the teeth are not, I ask the patient, do you have the ability to chew right now? And the patient says, yeah, I can chew. Then the answer is, well, How about if we do get some diagnostic information first? How about if you spit in a cup and let's send saliva sample out to the laboratory so I know what bacteria is growing there? And if you have aggressive bacteria, perhaps a combination of antibiotics and getting the root surface clean. And as you know, we have the most advanced technology you could possibly have, which, by the way, is the talent of our staff in addition to the technology. And we get the root surface clean. If we use a combination of the right antibiotic and we disinfect the root, the bone can grow back, and it often does. That's what I lecture about. That's why I went to Phoenix a couple of months ago to talk about that type of thing. So it is that type of thing where you were told, well, it's periodontal disease. You're never going to get it under control. Let's get it out and get the implants in, versus a skilled periodontist who says, well, no, there's some things that we can do. And by the way, if it doesn't work, we can also extract the teeth and put implants in, because we do that on a regular basis.
Well, yeah, that's kind of a good kind of like round the corner to the home stretch kind of question, because this comes back to the question about second opinions. I always go, you're the boss when you go into the medical office. Sometimes they don't make us feel like that, which is probably a problem by itself. But, I've always heard the wisdom of like, well, maybe you should get a second opinion. What do you say when people, you sit down and talk with them and say, wow, I think I need a second opinion?
Then I want them to get a second opinion. I think when you're shopping for a second opinion, make sure you're shopping with somebody who is capable of giving that second opinion. There's a reason why I'm a specialist. I mean, it is because there's additional training that I need. So if you're going to get a second opinion, get a second opinion from a specialist, by all means.
All right. Well, good. Well, we've been talking with Dr. Lee Sheldon of Solid Bite Dental, Dr. Sheldon and Furtado, right there on Sarno Road. You guys have been a fixture there, and we were joking about there's a big for sale sign out in front, and that's why your sign says, no, we're moving, and we're getting into the new place. But that's exciting what's going to be happening. You guys are going to be expanding all that. But I wanted to say, if people are wanting to take advantage of the Solid Bite Gives Back, what's the number again? Because that's a great program. It helps us as a charity. It helps you as a patient, because you get like the full panorama view of everything that's going on. And then it helps you guys as medical professionals. But how do people take advantage of that?
Just give us our office a call at 321-259-8000. Tell whoever answers the phone, whether it's Lindsay or Jennifer or Amy, that you heard me on the radio, Helping Seniors of Brevard, and you will get that special $50 to Helping Seniors of Brevard, and you'll get everything, all the diagnostic information, the 2-hour visit with us.
That's great. Well, always a pleasure to visit with you, Dr. Lee Sheldon with Solid Bite Dental. And we will be back on the radio every Wednesday, 12 noon to 1 p.m. right here on 90.3 FM. We look forward to seeing you back here next week. That's the time we have for today. Have a great week until then. We'll see you soon.